Hi, my name is Sonia Segui, and this is my video for the assignment for head-to-toe assessment for advanced health assessment. So initially, when you first enter the patient's room, obviously you're going to wash your hands and greet the patient, and you're constantly just assessing their general appearance, making sure that they don't appear to have any physical deformities, that they look appropriate to their stated age, that they're dressed appropriately, and just assessing that when you first encounter the patient. And so we're going to move forward and do a head-to-toe assessment if I have the consent of the patient.
Yes.
Okay. So I'm going to check for temperature and texture and just make sure that the patient's skin, always assessing for lesions or any open wounds in the skin. I'm going to check for turgor in the skin and make sure that everything seems normal. I'm going to look at the nail beds and make sure that there's no clubbing in the nail beds, and I'm also going to check for capillary refill and just to make sure that that is within normal limits, and it is. So after doing that, I'm going to move forward and start with the head and do an assessment of the head and scalp, and I'm just going to palpate the scalp and check for any lesions, open wounds within the scalp, and everything seems normal. So then I'm going to move down to the face and palpate the frontal sinuses and make sure that there's no tenderness, and palpate the maxillary sinuses and make sure that there's no tenderness there. Okay, and then I'm going to go forward and assess cranial nerves 5 and 7. So I'm going to check for TMJ and have the patient open her mouth. Good. And then I'm also assessing any asymmetry within the face, cranial nerve 7, just making sure that everything on both sides is appropriate. For the sensory part, I'm also going to just put this cotton swab in different areas of your face, your forehead, your cheek, and your chin, and just tell me if you feel it.
Yeah. Yes. Yes.
Good. So in assessing that, the head, I'm going to move forward and assess the eyes after the head and face. So I'm, again, looking at the eyes and making sure that the eyelids, the eyelashes, and the eyebrows look symmetrical. I'm looking at the sclera to make sure that there's no discoloration. I'll pull down at the bottom of the lids and check the conjunctiva to make sure that they're pink, and they are. So the next thing that I would assess is the pupils, and I want to make sure that the pupils look round and reactive, that the pupils are equal, round, and reactive to light and accommodation. So I'm going to need my pen light for this. So the first thing I'm going to do is I'll flash the pen light in the eye and assess that eye to make sure that it reacts appropriately. And it does. And then I'll flash the light again and check the other eye to make sure that the other eye is reacting appropriately together with the eye that I'm flashing the light in, and it does. So I will do the same thing on the other side. First checking for the eye that I'm flashing the light in to react, and then watching the other eye. Okay. And that's normal. So the next thing I'm going to do is test the vision. So first I'm going to test peripheral vision. So I'm going to take my hands and put them behind your head and move them forward, and just look straight ahead and tell me when you see my hands.
I can see it.
Okay?
I can see it.
Good. So the other visual test that I want to do is the 6 cardinal fields of gaze. So I'm going to put my finger and move it in different directions, and I just want you to follow my finger, and I'm going to be looking for any nystagmus within the eye. So just go ahead and follow my finger. So when I'm moving laterally, I'm checking cranial nerves 6, and when I'm moving medially, I'm checking cranial nerves 3, follow my finger, and medial downwards is cranial nerve 4. Okay, So I didn't see any nystagmus there, and everything seemed to be normal. So I'm going to move forward my exam. The next thing that I'm going to assess is the ears. So I'm going to just pull on the auricle and push down on the tragus and make sure that there's no tenderness. Okay. And then the next test that I would do to test acoustic nerve is check for the whisper test. So I'm going to have you cover your opposing ear, and I'm going to whisper something in this ear and tell me what I said.
1, 2, 3.
Okay, and then do the same thing on the other side.
1, 2, 3.
Okay. So that completes the assessment of the ears. So I'm going to move forward and have the patient check for patency of the nares. So if you could cover one nostril and take a deep breath. Okay, and cover the other nostril and take a deep breath. Okay, so any obstructions or any abnormalities? Okay. So the next thing that I'm going to assess is the mouth. So I'll have the patient open the mouth, and I'm looking for any dentitions, any irregularities. I'm making sure to assess the mucosa, make sure that the mucosa looks moist. This is also an opportunity for me to assess the hypoglossal nerve. So I'll have the patient stick her tongue out, all the way out, and just make sure that there's no deviations, that she can stick her tongue out midline, and everything looks symmetrical. Okay? So after the mouth, I'm going to assess the neck. So the first thing that I look for is just to make sure that the trachea feels midline, that the neck looks symmetrical on both sides, always inspecting the skin for any lesions or abnormalities. I'm going to start by assessing the lymph nodes. So I will feel for the submental nodes and then the submandibular nodes, and then the post-auricular or pre-auricular nodes, post-auricular nodes, and the occipital nodes. And then I'll move down to the deep cervical nodes, the posterior cervical nodes, and then the supraclavicular nodes. And just make sure that I don't feel any abnormalities there. So I've assessed the neck, and everything seems to be within normal limits. So I'm going to move down to assessing the chest. Again, I'm always inspecting and watching to make sure that rate and rhythm of respirations are regular, that the patient doesn't seem to have any retractions, and that her breathing inspiration is normal. So I'm watching in the front anterior just to make sure that everything's within line. And then I'll move to the back of the chest and the posterior wall. And the first thing that I will do is palpate the posterior wall, chest wall, for any lumps or any tenderness. And then I will listen to the 2 lobes on the left and the 3 on the right. And take a deep breath. Take a deep breath. Take a deep breath. Again. And one more. Okay, so everything seems normal. The next thing that I'm going to assess, excuse me, let me go back a minute, because in assessing the neck I kind of skipped over the carotid pulse. So when you're assessing the neck, you want to make sure that you assess the carotid pulse one at a time. So I'll be checking for the carotid pulse on this side and listening for any thrills, or feeling for any thrills, and then checking the other side and feeling for any thrills. And then And I'm also going to listen for any bruits. Okay. So the next thing that I'm going to do is I'm going to assess the cardiovascular. So I'm going to first find my PMI and check for any thrills or pulsations, and that's at the 5th intercostal space in the midclavicular line. So if I feel about here, then I'm also going to listen to heart sounds. And everything sounds normal. So I'm going to continue with my head to toe assessment, and the next thing I'm going to do is check peripheral pulses. So I'll start with the radial pulse. And then the brachial pulse. And then I'll come down and do her dorsalis pedis pulse. And posterior tibial pulse. And then last is the popliteal. Okay, and everything there feels normal, so I'm going to next ask the patient to lie back and assess the abdomen. So can you pull up your shirt a little bit? Okay. So I'm assessing and looking to make sure that the abdomen doesn't appear to be distended, that the skin looks intact, that everything looks symmetrical. And the first thing I'm going to do is auscultate for bowel sounds. And bowel sound normal, active. So the next thing I'm going to do is light palpation and assess for any tenderness. And just let me know if anything feels tender. And then everything okay? And then deep palpation. Just make sure that the patient doesn't have any tender areas in all 4 quadrants. Good? Okay. I'm going to ask the patient to sit forward. The next thing that we're going to assess is musculoskeletal. So we're going to first assess the neck and just do flexion and extension, just movements. And then lateral, so side to side, and rotation, and turn. And looks normal. Then the next thing we're going to do is shoulders and assess for range of motion in the shoulders. So I'll first ask the patient to just follow my lead and do what I'm doing. I'm checking for adduction and abduction. And then go both arms up. Okay. And then also for the shoulders, we want to do internal and external rotation. So put your arms behind, like this, and then like this. Good. All right. So then the next thing after shoulders, we'll assess the elbows. So put your arms like this and do extension and flexion. Very good. And then we also want to do pronation and supination. Good. And after elbows, we'll do wrist. So flexion and extension. And then inwards and outwards. Good. And fingers. Flexion and extension. Good. And then you put your fingers back up and then inwards and outwards. Good. Now to assess for the strength, put your arms out. Don't let me push your arms down. Don't let me pull your arms up. Okay. Don't let me push your arms outwards. Okay, now inwards. Okay, and for your fingers, same thing. Separate your fingers. Don't let me push them together. Okay, and put them together. Don't let me pull them apart. Okay, so that's for the upper extremities. Now range of motion for the lower extremities. For the hips, what we're going to do is, can you cross this leg over this leg? All right, going inwards and outwards, and then this one going inwards and outwards. And then knees, we're going to assess extension and flexion. So can you bring your knees up and put your knees down? Now I'm going to push against your leg, and don't let me push your leg back. Okay, now don't let me pull your leg forward. Okay, same on the other one. Push, don't let me push back. Don't let me pull forward. Okay, and for the ankles, we'll do dorsiflexion, okay, and then plantar flexion, push down and inwards and outwards. Okay, so we also want to assess the spine for flexion. So I'll have the patient stand up, and I'm going to ask you to just bend forward, and so I can inspect your spine. Okay. All right, and now that she's standing up, we'll assess for gait. So close your eyes. Okay. Close your eyes. And what you're doing is watching for the patient's gait to make sure she doesn't have any imbalances or disturbances, and after 20 seconds should be able to stay without having any gait disturbances. Okay? Go ahead and sit down. And then the last part that we will assess, part of the neuro, I'm going to give you 3 words. And then in a little while, I'm going to ask you to repeat those words to me. So, bat, cat, and ball. Okay? All right. So, in assessing the neuro, I'm going to put my finger here, and I'm going to ask you to just go like this to my finger. Okay. Now I'm going to ask you to alternate fingers and touching my finger. Good. Okay. What were the 3 words that I asked you to remember?
Bat, cat, and ball.
Good. So after I'm done, this concludes my head-to-toe video assessment for advanced health assessment for section 50 of 6002C.